Towards the lunch break, but we're having a session 4 on healthy environments and healthy life. And what I would love to do is to invite our moderator, Karolina Adamska, but also the 3 panelists, Abraham Esteve, Anna Bazan, and Almudena Muñoz Puche. Lovely names. So I welcome them on stage. And a big applause, yeah. But I would also like to do one thing, is to measure, because it's also about measurement, I would like to also measure a little bit the engagement in the audience, because we have 200-300 people following this live stream, but also what's the mood in the audience? Are we still engaged? Let's raise your hand if you're still engaged. Make some noise if you're engaged. Wow, that's about engagement. So, Karolina, yeah, I think this is already a conference where we're touching purpose. It's great, and now we're heading in the right direction because it's about healthy environments. So the floor is yours, and hopefully the mics will work. Otherwise, I will give you mine.
Okay.
It works.
It works.
Great.
Okay.
So the floor is yours, and you're having 30 minutes, and it's always challenging just before the lunch break. But
I know.
3 excellent panelists, so kick some ass.
I know it's the best time because it's before lunch. The worst is for sure after lunch, so we are lucky one because it's before. So good afternoon, everyone. Welcome to session 4, Healthy Environment for Healthy Life. My name is Karolina Adamska-Woźniak, and I am here in the role of Managing Director in Responsible Business Forum. And I will be serving as your moderator. So let me introduce my panelists. Anna Bazan-Korona. Anna is ESG specialist at Pharma. She gained experience in CSR and sustainability at a large capital group in the construction industry, where she was in charge of non-financial reporting, as well as the creation and coordination of social and employee volunteer programs. That's right? Hello, Anna. Almudena Muñoz Puche, it's correct? Thank you. Chair Cost Action of Industrial Symbiosis. Almudena is a bachelor's degree in chemistry and Master of Innovation and Digital Transformation with honors. She's currently doing a PhD program in Business and Administration, and she has extensive knowledge in R&D national and international projects and related to innovation and disruptive technologies. That's right?
That's right.
That's right. So this is the good place to check our mics.
So kind introduction. Thank you so much.
Okay, and my last panelist, Abraham Esteve-Núñez, is correct? Professor in Chemical Engineering, Principal Investigator of Bioe Group, founder of METfilter and Nanoelectra, Principal Investigator of Bioe Group. His scientific activity focuses on environment and biotechnology, specifically in the use of electromicrobiology for bioremediation of water, urban and industrial, and natural environments, as well as detection of pollutants. It's okay? It's correct? Okay, so first round, general round. Could you please tell us what's your private definition of health and healthy life? I think it's yours here.
Well, good. It's not working.
We have one more, so let's.
Yes.
Yes, that's right.
Yeah, okay, that's great. Anyway, I'm a professor, so I should be able to talk
without
a micro, okay? Don't worry. So, well, I am an environmental biotechnologist, so when I'm facing the health term that Karolina was saying before, I tend always to think about the environmental health, okay? So to me, one of the priorities where I'm trying to focus for the last 20 years is to clean up the environment, to achieve an environment free of pollutants, a healthy environment, and a consequence of this healthy environment, it should be translated into the human health. So in that context, I'm always, let's say, focused on the environment, and I'm considering us as a second generation, which is going to take advantage of taking care of the groundwater or the fresh water, soil, sediments. Okay, so I think it's one of the main points, and also another purpose that we have in the place where we are working in the university is trying to disseminate and educate people to be conscious about how important it is to take care of the environment in order to achieve a good health. And not just standard health in terms of infections and that kind of stuff, but also mental health, okay? So mental health is directly, I guess, benefit from live surrounded by a healthy environment.
Okay, thank you very much. Anna, so what's your opinion about, what's your definition of health and healthy life?
Yeah, I would say that health is a state of complete physical, mental, and social well-being, and not only absence of disease or discomfort. Yeah, shortly.
Yes, in short. So let me ask one question more. So do you think it's easy to be healthy in that having this definition on our mind?
No, it's not easy at all. We have lots of factors that we have to combine to feel really healthy. Yes. Internal and external factors, I would say.
Yes, so health is a very complex state.
Yes, it is.
And Almudena, so what's your definition of health and healthy life?
Well, my definition of health is quite connected with Diana mentioned. It's like this triple helix of mental, physical, and social well-being, but also taking into account my background of chemistry, I will say that also to try to live in a health environment with not pollutants, with bio-based products, and also with trying to encompass a more green world.
Okay, so I would ask second question, which will be deeper as far as your work is concerned and your interest is concerned. So how do your projects contribute to enhancing public awareness and involvement in creating healthier environments? So maybe...
I can start?
Yes,
Thank you.
It's your turn.
Okay, I came from CETEM. CETEM is a technological research center located in Spain. So we work like in different areas, and one of our areas and one of our projects is NYMPHE Smart. NYMPHE Smart is a European social fund project that has the objective of trying to boost social innovation through the pillar of entrepreneurship, but also twin transition. So we are trying to empower local communities to try to be safer and also to try to be more environmental conscious. Apart from that, we work also in soil health projects. For example, we work in a European project named Pharma. It's a project, a big project with more than 40 partners. And we will try to work on the aging. We work with elderly to try to give them some tools to try to be more independent, but at the same time to be in a constant connection with the health system. So we are providing them some digital tool and trying to promote their health to them, but always with independence. And finally, also we work in some projects related to circular economy and industrial symbiosis topic, because we believe that it's quite important to try to achieve a business model which could be very green, sustainable, and also to go farther for the future in terms of saving the planet.
Okay, thank you very much. Anna, what's your...
Yes, and do you know that an average Pole throws about 2.5 kilos of medical waste into the bin or flushed down the toilets every year? That's not a good news, and improper disposal of unused or expired medicines can cause water and soil contamination, can affect aquatic organisms, or develop antibiotic resistance. And to prevent all that, Adamet, together with the NYMPHE Group, the organizer of the campaign World in Your Hands, and with the pharma industry partners such as Pharma, Teva, and Zentiva, has formed for the very first time a strategic partnership to run a campaign, an educational campaign on proper disposal of expired and unused medicines. As a part of campaign that was launched in September, we prepared and delivered to more than 800 pharmacies educational materials for patients, such as flyers, posters, stickers for our first aid kits, paper bags with the instructions how to properly dispose of waste. With this project, we are strongly committed to raise awareness about the negative consequences of improper disposal of medical waste, of unused medicines. Some selected pharmacies were provided with covers for drug containers, so that the patients clearly know what to do with the unwanted medicines. So with this action, we want to not only improve the quality of our lives, but we also want to protect the environment.
Okay, thank you very much. Maybe you know that we as a Pole use a lot of drugs, right? So what's the... I don't know how it's in your countries, so maybe do you have some documents which we combine the use of drugs, but how many drugs we buy and don't use? Do you know what's the waste of drug business?
Well, I don't know exactly the numbers, but this is the question we need to elaborate and collaborate how to use or sell the exact amount of drugs that we need. Yeah, the proper doses.
Okay, so maybe as a last question, I will ask you for that. So what's your, Abraham, opinion? How do you, your project contribute to creating healthier environments?
Yes, well, in my particular case, I think I'm pretty lucky because everybody understands what water is. So I'm not working on projects where, you know, weird topics that it's difficult to explain. And I am trying to reach the engagement through, I guess, two different levels. Okay, if the projects can be implemented in real location, then it's easy because you can invite people, organize actions. So people could really be a witness of how sustainable and innovative treatments can really clean up polluted water on site. If we are developing activity which is more innovative at a low TRL, so we are still developing the activity, then we typically do through dissemination action, sometimes associated to interesting projects like NYMPHE projects that we are sharing with Agnieszka, for example, working on cleanup of micropollutant. And this is actually directly connected to my colleague comment about drugs. I'm at the other side, so I'm not so worried about how are they consumed, but what's going on after the drugs go into the toilet. So this is also a very nice, educational tool, because all the audience typically and the citizens are blaming the industries, for the contamination, the oil and gas, of course, even the pharmaceuticals sometimes. And they don't realize that they are polluting the water every single day when they go to the toilet. So antibiotic, hormones, all kind of antidepressants, all kind of hormones and chemicals go directly to the toilet. So when they realize that, wow, they are really doing something, then they are conscious and they are more open to really implement sustainable and new technologies in order to get let's say, a free environment or environment free of chemicals.
Okay, so we like successes, we like best practices, so I would, and we also remember it, so could you please provide us some examples of your successful initiatives or best practices that have led to measurable improvements in public health? So the question is for you.
Well,
yes.
we are developing different kind of projects at different levels of development. Most of them are devoted to clean up the water, so to remove the pollutants, so we can generate a clean water safe for the environment, and especially that this water could be reused. So I'm coming from a country with a huge problem with the water scarcity. So we are developing technologies for reusing the water after it's been polluted. So it could be used in irrigation or in industrial sites or even in the single family homes, okay? And we have developed this kind of activity. We are also working with companies, industrial companies from oil and gas, breweries, dairies, pharma companies, in order to treat the water on site in a sustainable way. That's what we are doing, because technologies for treating water and reusing water are already available in the market. So I guess my job is to try to make real innovation, decreasing the OPEX, generating new ideas and new concepts in order to implement these technologies in, special needs. So we are working with architects, for example, now, in order to implement in passive house buildings in downtown Madrid. So the neighbors, the guys could really treat the water in the very same place where they are produce it in a safety and a sustainable way, and reuse it in a safe way for irrigation of the gardens, for example.
Okay, thank you. And also, what's your successes or good practices?
Yes, Adamet is an innovative company. We produce generic drugs with added value. And added value can be combination of 2 or more active substances. It can be changes in the form of drug or the way the active substance is released. And the practice I would like to talk about today is combination drug. A combination drug is a drug that contains 2 or 3 active substances in one single capsule or tablet. In many diseases, patients have to take several or even more tablets or drugs from different therapeutic areas. It can be inconvenient and it can produce, mistakes in the therapeutic scheme. So using the combination drug makes the whole process easier, more effective, and what is more, it helps reduce the risk of skipping a dose or taking the wrong drug. It is especially important for elderly patients and for the people that have to take multiple drugs. But what is more, such a solution has also environmental benefits, because one combination drug means one package. A single blister, a carton box, instead of several separate packages. Less packaging, it leads to a significant reduction of the amount of resources used, as well as the production process and the waste cycle. And less packages means less paper and less plastic used, and less carbon emissions in the transportation process and in the waste disposal. So at the same time, we improve the quality of lives of patients, and we try to reduce our negative impact on the environment.
Okay, thank you very much. But as far as a medical company is concerned, I cannot see that there is a huge problem of plastics, right? Because you doesn't create or build a lot of plastics, but these initiatives you mentioned that plastic waste. So do you think that these initiatives really reduce the use of plastic?
Yes, because you have a combination drug, so instead 3 drugs, you just take 1 drug. So you have 1 plastic instead of 3 blisters, for example.
Okay.
So it's a reduction. Yeah.
Okay, thank you very much. Almudena, so what's your good practices and successes in that very complicated and sophisticated field?
Well, in our case, we work like with 2 main approaches. One is the research aspect. For example, we are trying to support our companies in doing industrial symbiosis. On that sense, for example, we are working with the agro-industrial area and companies and sector of Spain. As you know, in Spain there is a lot of production of oranges, artichoke, and all these kind of agro products. For example, in the case of the artichokes, there is tons of waste after the processing of the product to go for the final market. What we have done is to take these tons, treat the artichoke waste, and mix with the good fibers to make panels. With this panel, we are implementing in furniture companies to do some product like tables, wardrobes, or other kind of product. So our idea has been to reduce and maximize one of the industries that are very important in our country, especially in our region, and go for a second life situation in the furniture area. Apart from that, we don't just take and make 1 product. We try to make a different approach, and the different approaches, for example, we use biotechnology to try to extract the pigments and also to try to give color and different substances for the furniture sector. So on that sense, in the research area, we work a lot on the reduction of pollutant, the reduction of waste, and trying to increase the awareness of healthy environment. And on the other side, or in the other approach, we work a lot with the capacitation and the training. We have worked with local communities to try to support them in the twin transition and also in the environmental well-being awareness. So in that case, we had since 2020, well, after the pandemic, the last part of 2020, we started implementing specific courses with unemployed people, but also with working and manager to try to give them a specific action to make a real in their businesses, but also in the daily life. So after this almost 4 years, I could say that we have obtained more than 70% of people implementing action and with a real satisfaction.
Okay, thank you very much. As far as ESG and sustainable development, collaboration, cooperation, then working together seems like the most important thing, I think. But how does collaboration between industries and different stakeholders help reduce harmful environmental impact? So maybe your turn.
Well, we are working very closely to end user industrial sites, all kind of industries. Just to give you a funny example, everything is not about water. We have also one project called Beer for All, which is in a consortium with a large brewery company in Spain, and we are not just treating the water to get rid of the pollutant, but also recovering the nutrients. So in the wastewater from the beer, there are a lot of nutrients that could be recovered and could be converted into a valuable added compound. So we can convert, for example, the nitrogen and the protein, nitrogen from the beer into microbial protein that could be used, for example, for feeding fish. We can also get rid of the phosphorus, which is in the wastewater, through a very innovative and funny ways, in order to get fertilizer. Okay, so from the brewery's water, we can get water for reuse, microbial protein for fish, and fertilizer. So definitely, this is also an opportunity for sectors which were fully devoted to another purpose, like selling beer.
Thank you very much. And now what's your opinion, or maybe not opinion, but what do you think about collaboration and how it works at your field?
Yeah, I would like to tell you about what interested maybe should do or think about doing. Well, pharmaceutical production was moved to Asia mainly for cost and environmental reasons. Asia offered cheaper raw materials, lower production costs, and environmental regulations were less restrictive than here in Europe. But events such as the COVID-19 pandemics, the war in Ukraine, and the disrupted supply chains have shown how heavily Europe depends on the pharmaceutical production from Asia. So this is what forced European countries to reconsider bringing the production back to Europe. As an example, we can say about France that has brought the production of paracetamol to Europe, but still the API, I mean the active substance, is produced from the chemical raw materials that are still produced in Asia. So the key challenge is that the return of chemical production shouldn't be done under the old rules that had a negative impact on the environment. The new technologies must be greener, must be more sustainable, innovative, and Europe must face or be prepared to face higher costs because those initiatives will not be cheaper. And for this process to be successful, there must be a broad cooperation between industries in the whole value chain, as well as the commitment of governments. Because we have to remember that these costs of new innovative technologies cannot be transmitted to patients. Yes, so the process, the relocation of chemical and pharmaceutical production must be supported by governments and requires collaboration of many industries and requires well, supportive public policies, because the goal is one. It is medicine security. I mean that so that everybody has access to the medicines they need.
Okay, thank you very much. Almudena?
Thank you. Well, for us, cooperation is our key aspect in every project or in every solution that we develop. For example, for the project that I mentioned before, that is for the increase of the independence of the elderly people, we have not only worked with the elderly, we also create since the beginning and integrate the public actor, the health system, because we believe that we need to change a little bit the health system, especially in Spain, because it's a very face-to-face method, and we need to go and use the technology and also to try to approach the different lives and the different situations that we have. So we encourage a public sector to change a little bit and to use the platform that we developed, but at the same time also to try to provide to the caregivers some support and some tips to go and to manage with the elderly. Apart from that, in other projects, we also do the same. We make the cooperation with local communities since the beginning of the project or even before to try to see their really gaps, their needs, and to see how we could support them. Because the reality is that there is a lot of solution, a lot of projects, and if we want to make a real impact, it's important to do co-innovation processes and to go for co-creation methods in every solution and in every implementation.
Okay, thank you very much. We've started 4 minutes later, so I think that we have 1 minute more. So just one key messages which you would like to leave our viewers with. But one.
A very quick reflection. I guess that any human activity, doesn't matter if it's industrial or urban, now considering that there is a technology available for treating wastewater and recovering nutrients, should really have a plan to treat and recover nutrients in a decentralized way. Okay, so we should be able, and now we are actually able to treat, decontaminate, and remove nutrients on site, exactly where the water is produced.
Thank you. Anna?
Well, healthy environment is the basis for a healthy life. So we should be really interested in taking care of it. Clean air, clean water, access to healthy food will support our bodies and improve our quality of life. We also should think about environment in context of future generations so that we provide them with healthy living conditions.
Okay, and Almudena?
As our keynote speaker Thomas mentioned before, we are here in the planet to cohabit with the planet, not to be the host of the planet. So in that sense, I think we have to cooperate all together and try to not forget that if we want a healthy environment and a well-being, we need to work all on the same page and to continue working together.
Okay, thank you very much. Thank you for your time. So Almudena, Anna, and Abraham.
Whether the mics will work, or otherwise I would take mine. Yeah, normally they work. Actually, they work. So it's like they're flowing in. Well moderated, very insightful also to hear interconnected best practices, how we can make it healthier. When it's about health, it's also about food. So I think it's an excellent moment for 45 minutes for lunch. Also, people were falling asleep. Come on, you should go earlier to bed. 45 minutes. After this great lunch, and it's also a networking opportunity, we will come back for an interactive quiz with big prizes. So see you back 45 minutes, and a big applause for the panelists.